I'm Sophia Tripoli, Director of Healthcare Innovation at Families USA and proud member of Consumers First, a unified coalition representing consumers, children, labor unions, and employers working together to address our broken healthcare system. Today, I wanted to talk to you about a critical issue in our fight to make healthcare more affordable and higher quality for families across the country. The cost of American healthcare is a profound economic problem and an urgent public health problem, which has now been further compounded by the COVID-19 pandemic. 44% of the public report not seeing a doctor when they needed to because of the cost. And 30% say that medical care interferes with their basic needs like food or stable housing. One of the ways we can fight back and influence the way healthcare is paid for and delivered is by responding to proposals the federal government releases on the types of payment and delivery changes they are considering. Sending the federal government a comment letter creates a legal obligation for the administration to consider and respond to our feedback. Recently, the federal government released its annual proposal that determines how hospitals are paid for inpatient services through the Medicare program, referred to as the Hospital Inpatient Prospective Payment System proposed rule. Consumers First, the alliance to make the healthcare system work for everyone, is responding to that proposal by sending a detailed comment letter to the federal government. Our letter makes three overarching recommendations. 1. Currently, the healthcare system is not designed to address or reduce the long-standing health disparities impacting communities of color, those with disabilities, those with low income, and those living in distressed neighborhoods. As a result, the healthcare system is not accountable for the ways in which it is providing poor quality care and result in poor health to these communities. Our comment letter tells the federal government to require hospitals to collect and report information on the quality of care provided based on race, ethnicity, primary language, geographic location, socioeconomic status, gender identity, sexual orientation, age, and disability status. This is a fundamental step in being able to hold the healthcare system accountable for reducing disparities in healthcare quality and health outcomes. 2. Currently, the healthcare system blocks the ability of consumers, workers, and employers from knowing how much we are paying for healthcare until after the healthcare has already been provided. As a result, we are recommending that the federal government require hospitals to report on the price and quality of healthcare services so that consumers, workers, and employers know the cost and quality of healthcare before it is received. And 3, the federal government is considering making a change to how Medicare pays hospitals by using prices determined in the private market. But the private market has become highly consolidated over the last 2 decades. Importantly, healthcare prices determined in consolidated markets reward those entities who hold more market power and further entrenches the distortions in healthcare payment that drive up prices for our nation's families, workers, and employers. That is why Consumers First strongly opposes making this change to how Medicare pays hospitals. And instead, we are recommending that the federal government consider regulatory approaches to address consolidation by restoring competitive markets in the U.S. healthcare system. To read our full letter, search Families USA's resource page for Consumers First comment letter to the federal government on the Hospital Inpatient Prospective Payment System proposed rule. And if you are interested in joining the Consumers First movement to fight back against the ways the healthcare system is broken, please send an email to consumersfirst@familiesusa.org. I'm Sophia Tripoli, Director of Healthcare Innovation at Families USA, and thank you for watching.